Today, we're going to go through Lisinopril. The brand names are Zestril, Prinivil, and Qbrelis. The therapeutic category is that this is an antihypertensive drug. More specifically, it's an ACE inhibitor or an angiotensin-converting enzyme inhibitor. Indications are that it's used in hypertension for blood pressure management. It's also used in heart failure with reduced ejection fraction. It reduces the signs and symptoms of systolic heart failure. It's typically used as adjunctive therapy. The third indication is in ST elevation myocardial infarction, or STEMI. In hemodynamically stable patients, it's used within 24 hours in the treatment of acute MI. Some of the off-label indications for Lisinopril are in non-ST elevation myocardial infarctions, or NSTEMI, in post-transplant erythrocytosis in renal patients, in chronic kidney disease or CKD, and in stable coronary artery disease. The typical dosage form is in tablets, but it also comes in a solution. The tablet comes in several strengths. It comes in a 2.5 milligram, a 5, a 10, a 20, a 30, and a 40. The solution comes in a 1 milligram per milliliter concentration. Dosing for hypertension, it starts at 5 to 10 milligrams once daily with patient evaluation every 4 to 6 weeks. The dose is doubled until the recommended 40 milligrams per day is reached or the patient tolerance, whichever comes first. Dosing for acute coronary syndromes. NSTEMI, you start at 2.5 to 5 milligrams once daily, started within 24 hours of the event, and you titrate up to 10 milligrams per day with a max at 40 milligrams per day. NSTEMI, which was off-label, is between 2.5 to 10 milligrams started once daily, titrating up to 40 milligrams a day. Other off-label dosings, such as for transplant patients, is 2.5 milligrams to 10 milligrams once daily, so it's pretty similar to NSTEMI or STEMI dosing. Lisinopril is also used in hypertensive pediatric patients with limited data. The dose of 0.07 milligrams per kilogram per day, dosed once daily with a max of 5 milligrams per day, is initiated, and the goal of 0.6 milligrams per kilogram per day or 40 milligrams per day as the max is what's generally accepted. Mechanism of action and pharmacology. Lisinopril works through the competitive inhibition of the angiotensin-converting enzyme, which is responsible for converting angiotensin 1 to angiotensin 2, which is a strong vasoconstrictor. Next, a reduction of angiotensin 2 increases plasma renin activity, which decreases secretions of aldosterone. Then, a decrease of angiotensin 2 also decreases adrenergic outflow from the central nervous system, while vasoactive kallikreins are also decreased. So this medication is not metabolized. The excretion occurs in the urine with the drug being unchanged. The onset of action is typically within 1 hour with a peak at 6 hours. The median peak is somewhere between 5 and 7 hours. The medication has a 24-hour duration, and the half-life is at 12 hours. There's also special considerations in renally impaired patients. Side effects. So the major ones are cardiovascular hypotension and dizziness. The minor ones are syncope, chest pain, headache, a change in the sense of smell, skin rash, and vision issues. There's a warning for cough, angioedema, and cholestatic jaundice. Drug interactions. Lisinopril may increase allopurinol hypersensitivities. There's also a diminished effect when used with amphetamines. ARBs generally enhance adverse toxic effects of ACEs. You also want to watch out for sources of potassium, such as potassium-containing salt substitutes. Antipsychotics, mood stabilizers, and barbiturates may increase the hypotensive effects of Lisinopril. Do not use if pregnant due to fetal toxicity. If the patient is or is believed to be pregnant, discontinue immediately. This medication will cause injury and can lead to death of the fetus. Monitoring parameters. potassium, renal function within 1 to 2 weeks after initiation, and pregnancy in females. Also monitor liver enzymes and serum bilirubin. Patient counseling. The main thing is to watch out for cough. Headaches are also common. Another concern is to watch for dark urine. Patients sometimes also experience fatigue and an abnormal heartbeat.